Hi everybody, it's Dr. Newman. I want to talk a bit about breast augmentation done from the axillary approach, done through a scar that's underneath the arm. I can tell you that I am not a big fan of this. When you're going through the armpit is hair-bearing skin and the armpit is rich in sweat glands. So there's a slightly higher risk of infection going through that approach. And that's the first issue. But more importantly, in this day and age where we're using mostly silicone implants, not saline implants, the implants are fully filled before we put them in. So saline implant, when we place it, it's pretty much an empty implant, but with a silicone implant, it's a filled implant. And to place that implant through the axillary, through the underarm approach, you're almost going through a little bit of a tunnel before you get into the pocket. And although, yes, you can put that implant in pretty easily using a funnel, which I use no matter how I put the implant in, if for any reason that implant then needs to be repositioned, and frequently that involves taking the implant out, editing the pocket a little bit, and then putting the implant back in, it's almost impossible to do that through the axillary approach. So when I see patients in my practice that have had implants placed through the axillary approach, very frequently I'm seeing implants that are in the wrong position. In the days when most of the implants that I placed were saline implants, I placed lots of implants from the underarm, and typically I would do that using the endoscope, which allowed me to dissect that pocket and be able to get low enough so that the implant would be in the right position. But if for any reason I needed to take that implant out, I could simply deflate it, do what I need to do to the pocket, and then put the implant back in, which is difficult to do with a silicone implant from under the arm. That's something that has to happen as part of surgery pretty often. And because of that, to me, I just think that the approach from underneath the breast is just the most logical approach.